I think social prescription has an enormous role for people with dementia, and the arts in particular, whether it's reading groups, singing groups, drama. The important thing is not only to stimulate the mind, but also to create a social experience. And perhaps if I was to say one thing, it would be we must ensure that people with dementia can access social prescription at a very early point, because that enables us firstly to delay the onset of any deterioration, but also to make sure they're already linked to those arts interventions at an early stage, which might be more difficult as the disease progresses. What the arts do for people is someone said this morning, it gives them a soul. It gives them an interest, it gives them connection with people, it gives them back a bit of themselves, which they may have had in the past, whether they were singing, reading, painting or whatever. And it not only gives them back their lives, it also gives their carer support, and speaking as a GP, it gives my patients another way of improving their lives and improving their health.
My name is Charles Alessi. I'm Senior Advisor Public Health England. I'm delighted to be able to support the whole concept of people retaining contact and connection with the arts. We know now more than ever that both social isolation and cognitive inactivity are risk factors towards people developing cognitive decline, especially as they grow older. It is fundamentally important for people to retain meaning and purpose, and I know no other better way than to maintain contact with the arts and with the community to achieve this.
My name is Georgie Chimbani. I work for Essex County Council as a Director for Local Delivery. I also hold a role with ADASS, which is the Association of Directors of Adult Social Services, as the Dementia Lead. I'm here today to be part of this amazing conference about social prescribing, or dementia and the arts. As local authorities, ADASS is certainly committed to social prescribing and the arts in any form of dementia therapy or working with people living with dementia. It fits very much with the local authority agenda in terms of early intervention, prevent, reduce and delay under the Care Act 2014. Traditionally, we tend to work with adults who are vulnerable, who need social care support. But actually what's so exciting about social prescribing is it's changing our focus from waiting to respond to people who are in crisis and actually working with people before they get into crisis. So what we're actually saying is we have a role to support you when things are going okay and you possibly just need to be directed or connected with some resources in the community that will enhance your life.
My name is Dr. Marie Polley and I'm co-chair of the Social Prescribing Network, and I work at the University of Westminster, and we've been working with NHS England and other partners to spread social prescribing and get it into the NHS and really support an individual with all the complex needs they have. It's really important that at the point of diagnosis of dementia that a person is referred to a link worker and they can be supported to then find the right organisations that will work with this person to reduce the shock of the dementia, make friends, meet other people, still get out and do things, and really support and work positively with a person.
I'm Professor Martin Green. I'm the Chief Executive of Care England. I think this is a real moment in time for the arts, because we've now got some very clear direction around social prescribing, and I want to applaud Arts for Dementia for bringing together such a diverse group of people for a conference that's going to look at the impact which social prescribing can have and make sure that we all work together to improve the quality of life for people living with dementia. I'm really impressed with this conference, and particularly with the diversity of delegates. We have people here from arts organisations, from local authorities, from the health service, from voluntary organisations, and they've all come together with one clear purpose. How do we make sure that social prescribing really gives people a better quality of life and nurtures their soul, as well as making sure that their bodies are healthy?
I'm James Sanderson. I'm Director of Personalised Care at NHS England and NHS Improvement. Social prescribing is a core element of our comprehensive model for personalised care. Social prescribing enables people to connect effectively with activities in their community, whether that's sports or leisure or arts or culture-based activities, or just getting out and about in the natural environment and connecting with people. We're seeing increasing enthusiasm for social prescribing. We set out in the NHS long-term plan that we want to roll social prescribing out all across the country through a network of 1,000 link workers over the next 12 months that will support people, asking what matters to them and enabling them to connect to activities that are going to help improve their health and well-being.
Well, I've been astounded many times to see what music particularly, but all the arts can do in making life for somebody who has been diagnosed with dementia, one or another form of dementia, making life worthwhile again, giving people ambition for the future and interest, making them feel human again when they were beginning to feel perhaps they were lost to the world. So I think the arts, and in particular music, are absolutely essential part of living with dementia, and we must promote the arts right from the moment of diagnosis onwards if we're to improve the quality of life of people.
I'm Veronica Gould, the founder of Arts for Dementia, and organised today's conference, the Arts for Dementia Best Practice Conference, towards social prescribing arts and heritage for dementia, because it is very early days. But ever since founding Arts for Dementia, I've been really keen that we should achieve direction to arts on diagnosis. And with social prescribing, we can actually achieve this.